Hi, Mike Gibson and Jung-Min Ahn, coming to you live from ESC 2024. And we're talking about the ASSURE DES study. Common question, what do you do with antiplatelets before non-cardiac surgery? So talk to us about what you did.
Thank you, Mike. I think the ASSURE DS trial is the first randomized trial. What is the try to evaluate what is the best optimum antiplatelet therapy in patient with the drug-eluting stent who scheduled for non-cardiac surgery. Actually, this patient have a high risk of bleeding and high risk of ischemic event. So we need balance between the bleeding risk and ischemic risk. Previously, we thought that this patient may have the higher risk. So every guideline recommended to maintain the single antiplatelet aspirin during the perioperative period. But most of this data came from the expert opinion or the cases reached from the first generation drug-eluting stent experience. So we randomed the 926 patients into no antiplatelet therapy versus maintaining aspirin monotherapy during the perioperative period, assigned to the inpatient 926 patient. So with no antiplatelet therapy patient stop all antiplatelet 5 days before, and we start antiplatelet therapy as soon as possible after operation. So aspirin therapy groups continue the aspirin monotherapy during the whole perioperative period. The finding is very interesting. Event rate is very low. Only 7 patients experienced the perioperative primary endpoint. The primary endpoint included death from any cause, myocardial infarction, stroke, and stent thrombosis. More importantly, there was no stent thrombosis in both the two groups. So we found that there is no significant difference regarding primary endpoint, death from any cause, myocardial infarction, stent thrombosis, and stroke in both groups. So event rate is just
And was there any difference in bleeding?
Yes. So major bleeding, no difference, but the minor bleeding, 14.9 in aspirin group, no antiplatelet group is 10.1. So statistically significant. So major bleeding, but no difference.
And how long was it after the stent was placed? Was this months, years?
Yeah, in our hard randomized population, 88% received the second generation DES, and around 10% received the first generation DES. The duration from the PCI to surgery is around 5 years.
5 years. Okay, so this is very late after surgery.
Yeah, right.
Common question. Thank you for helping answer it. And it looks like very low event rates and more bleeding. So does this change practice?
Excuse me?
Does this change practice, Jung?
Yes, most important limitation of our trial is low event rate. So, the one cause is we didn't measure the perioperative myocardial injury. The myocardial injury called we did not measure systematically. We didn't measure the troponin or CKMB. So we just evaluate myocardial infarction as a clinical surveillance. That is due to the low event rate, I think. But I think low event rate itself is the very strong evidence that if we do the good operation, contemporary DES may not that bad in patient who underwent the non-cardiac surgery.
Well, Jung-Min, thank you for joining us today. And thanks to all of you for joining us here live from ESC 2024.